Secret hacks for a healthy vagina. Stay fresh, clean and infections. In this video we will be showing and teaching you on a few tips for ladies on how to protect the vagina from infections and keep it clean. 1. Do not wash the vagina with soap, or else you will wash off something called lactobacillus that protects the vagina from infections. 2. Don't put your hands deep into the vagina in the name of washing it, as your fingers also carry bacteria. 3. Only wash thoroughly with clean water when bathing. 4. Avoid taking too much antibiotics. Before you take any antibiotic, make sure you have been diagnosed with the bacteria. 5. Avoid multiple sexual partners to avoid different kinds of infections. Before we move on, kindly support us by clicking the subscribe button, like this video, and share to encourage us create more interesting content. Thank you. Now that you have done that, let's continue. 6. Practice safe sex. Use protection to prevent sexually transmitted infections, STIs, and maintain a healthy intimate hygiene routine. 7. Avoid harsh products. Steer clear of scented feminine hygiene sprays, douches, and harsh soaps, as they can disrupt the vaginal pH and cause irritation. 8. Keep the area dry. After bathing or swimming, dry the vaginal area thoroughly to prevent excess moisture, which can lead to bacterial or fungal growth. 9. Get regular checkups. Visit a gynecologist for routine screenings to ensure overall vaginal health and catch any potential infections early. 10. Know your body. Pay attention to any unusual changes like itching, odor, or discharge, and seek medical advice if needed. 11. When menstruating, don't use pads for more than 4 to 5 hours. 12. Wear breathable underwear. Cotton underwear allows air circulation and prevents moisture buildup, reducing the risk of infections like yeast infections. 13. Change pants every day and don't keep them in the hamper. Wash them as you remove them. 14. Try to go for cervical cancer screening, and for those girls from 9 to 14 years, their parents should take them for human papillomavirus immunization, which is ongoing now in primary health centers and it's free. Maintaining vaginal health is essential for overall well-being, and these simple yet effective habits can help prevent infections and keep the area clean. By practicing good hygiene, making smart lifestyle choices, and staying informed about your body, you can protect yourself from unnecessary discomfort and health issues. Remember, if you notice any unusual symptoms, don't hesitate to seek medical advice. A healthy vagina is a happy vagina, and taking care of it should always be a priority. For vaginal discharge, as you get older, you may notice a discharge from your vagina between menstrual periods. It is normal to have some vaginal discharge. The amount, color and thickness of this discharge are different for each person. Normal vaginal discharge is thin, clear, white or slightly yellow in color. Often increases 2 weeks before menstruation. May change or increase with some birth control methods. Has no bad odor. Does not cause itchiness or irritation. Normal vaginal discharge is made up of a liquid, mucus, and bacteria. The mucus helps to clean the vagina. There is both good and bad bacteria in the mucus. The good bacteria keep everything in balance. Small amounts of yeast may also be present. Bacteria help yeast from growing out of control, too. When one kind of bacteria grows too much, you may have an infection. After intercourse, you may notice a musky odor. If the odor lasts more than a day, it may mean that you have an infection. These are the signs of vaginal infections. A vaginal discharge alone does not mean there is an infection. If you have any of these other signs, or you have unprotected sex without a condom, you should see your healthcare provider. Vaginal itching, burning or irritation. Thick, white vaginal discharge. A change in what the discharge usually looks like. Bad odor that lasts more than a day. Painful intercourse, painful urination, pain or tenderness in your lower abdomen, tummy, blisters, bumps or sores in your genital area. Treatment: patient talking to doctor. Each infection has its own treatment. Most vaginal infections are not serious and can be cured with prescription medicine. If not treated, your symptoms may get worse or put you at risk for future problems. Sexually transmitted infections, STDs, can be more difficult to treat and are easily spread to others. That is why it is important to see your healthcare provider to know what to do. All women who are sexually active need to see their healthcare provider at least once a year. Do not douche unless your healthcare provider tells you to. These products do not prevent or treat infections. Instead, they can kill the good bacteria, change the balance of organisms in your vagina, irritate the skin or cause vaginal infections. If you have a vaginal infection, take all the medicine as prescribed. If you stop taking the medicine before the infection is completely cured, the infection may return. If the doctor prescribes a vaginal cream, do not use tampons while you are using the cream. The tampons will absorb the cream. Do not have intercourse until your treatment is finished and you have no more signs of infection. If your doctor says the infection can be spread through intercourse, tell your partner. This is very important because your partner may also need treatment. Thanks for watching, and I'd love to hear from you in the comments below. What were your experiences like? Be sure to share your thoughts and let me know if you have any questions. And if you're looking for more health and wellness content, be sure to check out my other video on our channel.